morning, everyone. Today we are going to start the third unit, that is managed care. Okay, we will see what is this managed care. So in this managed care, so what do you mean by a managed care? The name itself is telling, which is like describing a type of healthcare that is focused on helping to reduce the cost while keeping quality of care high. And this is like started in United States of America. This is started in United States of America. Mainly, this term is used to describe a type of care that is focused on helping the patients. Okay, that is focused on helping the patients, and not only helping the patients. It doesn't mean that we are reducing the cost of the patient. It doesn't mean that we are not providing the quality of care for the patient. Here in this management of care, we can see a good thing is that here they provide a quality of care in a reduced cost. So that is called managed care. And mainly this is organized. This managed care is like to organize the managed cost and utilization of the quality of the services that is provided by the hospital or the network of the hospital. And this is also likely like organized. This is an organized way. Okay, if you see this managed care is a organized way to deliver the healthcare services by utilizing the healthcare resources. You have a lot of health resources, right? So to utilize this healthcare resources, they provide quality of patient care to the people who just claim or who come under this managed care organization. Okay, now it is also now this managed care organization also, if you take, this is also same like an insurance. Okay, this is also an insurance, but there is a quite difference with insurance and the managed care. So when we see in detail, you will come to know what is the difference between this insurance and a managed care. So in insurance, we have seen till now what are the advantages, disadvantages, and how is this opted for the insurance or a policy holders. Okay, and now in this managed care, one thing you have to remember is that it is a care, or it is a type of care provided to the patients or the policy holders in two ways. That is, one thing is helping the patient to reduce the cost. We will reduce the cost, or we will provide the services in the affordable prices. And the other one is, as we are reducing the cost, it doesn't mean that we are not providing a high-end quality of care or a quality of care. We are giving this too. We are reducing the cost to the insurance holders, insurance or a policy holders, and in the same way, we are providing a quality of care to the patients. Understood? So there are certain benefits. If we see, we have certain benefits in this managed care. So what are these benefits? Is one thing is increased resources. The policy holders will have increased resources in so that they can opt for the healthcare services. And next one is predictability of the cost. If you see in this managed care, the policy holders can predict the cost of the treatment that they are getting, or they can predict the cost of the services which they are receiving through the managed care procedure. Okay. And next one, again, if you see, we have like extra services for the members. Okay. Here, another benefit is it will provide an extra services for the members. And if you come to this point, okay, this is overall benefits of a managed care. But once we enter into this managed care organization, you have types of organization or types of managed care. If you see, for that, if you see, for few extent only, we have extra services for the members, and how this is like, we will see in detail. And next one is coordination of care. Yes, there is a well coordination of care and a well coordination between the caretaker and the patient, okay, or a policy holder. There is a continuous coordination of care of the patient, and this most managed care focus on preventive services. Okay, this mainly focus on the preventive services rather than the curative services. You know what is preventive service? What is preventive services? Before a disease is affected for us, okay, before a disease is being affected for us, we will take certain precautions, right? We will take certain precautions in order to prevent the disease. Now, we all took COVID vaccine, right? We all took Covishield, Covaxin, some of the other vaccines we all take. Why did we take? It is nothing but it is a preventive measure, so that in future or so that in further we will not be affected with such disease. Okay, it is like a preventive shield for us. Yes or no? So in the same way, it is a preventive service. What is curative service? If you come, when you talk about curative services are what? Curative care. Curative care is the care that you receive after you are affected with certain disease. That is curative care. The difference between preventive and curative. Curative is before the disease is affected, you are taking certain precautions and managing with your balanced or a good health. Coming to the curative, curative is what? After you are being affected with the disease, you will take a proper care and all. And the other advantage, mainly thing here in this managed care is that they will provide more coverage. What do? They will provide more coverage for generic medications. I know you have an idea about this generic medicines. We have few medical pharmaceutical shops also. If you see in Gandhi Hospital, inside near the OP, you have a generic medical pharmacy. Okay, so what is that generic medical pharmacy? There, what happens is you will get medications, or you will get a medical quality of medical what is that medications and all for the lower cost. As you are getting it lower cost, it doesn't mean that it is not effective for your condition. It is for the lower cost. At the same time, it have a good progress to improve your health condition. So that is about your managed care. I hope you understood. And coming here to this managed care organization. Okay, you have here a managed care organization. So here coming in the managed care, just a minute, managed care organization is nothing but it is a healthcare company. Mainly, it is often called a health plan, and it is a group of doctors, hospitals, and other providers who work together to meet your healthcare needs. And the meaning itself is telling organization, manage care organization. So, group of people who are involved in the healthcare plan. Now, who are involved in the group? Doctors are involved, hospitals are involved, and the other providers who they just form a group like structure, or they meet together and they render the healthcare services to the group of people or to the policy holders. And here coming to this, next you have certain characteristics in this managed care. Okay, characteristics in the managed care. So what are these characteristics? There are certain fundamental characteristics in this managed care. So first one is premiums. Okay, these premiums are like generally negotiable. Here in this managed care, we have like the premiums which are there are generally negotiable, and they have a contract and they also purchase a policy among the MCOs and the bosses. That is one fundamental character. And next one is mainly they work like insurance agency and they will accept the hazard that is being affected by the insurance holders. Okay. And next, mainly this provides medical services according with the agreement. So whatever the agreements that are there that we have to provide for the supplies, we will be providing for them. And here, when you come to this managed care plans, we have, so before we go to the managed care plans, I just wanted to talk about this managed care organized healthcare. Managed care organization. So what is this managed care organization? So this managed care organization is nothing but it is a healthcare company. Okay, this is a healthcare company, and it is also called as a health plan. This managed care organization is also called as a health plan. And here, if you see here, as we discussed just now, like you have team of members or group of people saying like doctors, hospitals, and the other providers, they all work together to meet the healthcare needs of the patients. Okay. And next here in this managed care, you have a contract. Here what they do is they have a contract with the healthcare providers and the medical facilities. Now, if these medical providers have to provide a care for the patients, if they want to provide a care for the patients, what do? Like they need some medical facilities, right? So they form like a network. They want to have a contract, or they want to have, they form just like a network. Now, what network? Between the healthcare providers and the medical facilities, and their concept and their goal is to provide care for the patients. I already said, we already discussed how they're going to provide the care, mainly to reduce the cost. Mainly, they will reduce the, in a reduced cost or in a decreased cost, they are going to provide the care for the patients. And these providers make up the plans network. So what these all providers they do is, they will provide or they will make up a plan networks, like how we can plan a network for the patients, or how we can render a network for the patients, and who all will come under the policy. Okay. And next, if you see, we have like 3 types of managed care plans, that is HMO, health maintenance organization, preferred provider organization, and point of services. In spite of this, you have like many more. Okay. Coming to the network. Okay. Before just we will talk, just remember one thing, that you have a list of doctors, healthcare providers, and they are tend to have a bond or a contract with the medical care members, where it contracts with the insurance company. It contacts with the insurance company. So coming to your HMO, what is this health maintenance organization, which we discussed earlier? Okay, this health maintenance organization, which we already discussed in the starting thing. Just a minute. And next, if you see, you have staff in this. If you see in your textbooks, you have a staff model HMO. Just a minute. Yeah, we will see this. Okay, staff model HMO. So what is the staff model HMO? Here what happens is, your patient can receive services. Here the patient will receive the services only through a limited number of providers. As you are having lot of providers here, according to the scheme, according to the insurance, according to the managed care organization, the policy holder can claim according to the benefits the patient is being received. Okay. So here in the staff model HMO, here what happens is, the patient can receive the services only with the limited number of providers, not with all the group of people, or not with all the group of doctors, or with the specialized doctors. It will have only limited number of providers, where the physicians are like come under the HMO employees. They come under the health maintenance organization employees only. They will provide the care for the patients, and they also belong to the HMO network. And here they are a they are a salarized employees. Okay, here they are a salarized. Who are salarized employees? The providers who are providing the care for the patients are the salarized employees, and they may receive a bonus. Okay, according to their work, according to their network, according to their services that they are rendering, they may receive a bonus and incentive income in staff model HMO. And coming to a group model HMO, okay, this group model, the name itself is telling you have most of the information with your headings or with your questions itself. So just you have to understand and you have to learn. Okay, here this what is this group model HMO is? It have a contract. Here what happens? It is having a contract with a single multi-speciality medical group. It will select a multi-speciality medical group. So that's why the name is telling you as group of like group model HMO. Just group model HMO. And here what happens is, they will provide the medical care to the HMO membership who are involved. Okay, the providers, the insurance holders or the policy holders who are involved in this HMO, that is the medical, sorry, those who come under the health maintenance organization only. They will provide the medical care to the so and so members who are having this to the health maintenance organization, and they are known as group model HMO. So these are called as a group model HMO. And what they do is, they work mainly what they do is, they work effectively with the HMO group of people or non-HMO patients as well. Okay, what they do is they render their care or they work with the health maintenance organization as well as the non health maintenance organization, that is patients who are out of this health maintenance organization, and this pays a medical group. So what this HMO do is they pay a medical group, which the group distributes among its physicians. So what this HMO group will do is it will give a salary, or you can tell that it will pay to the medical group. So and so amount, sum of amount is paid to the medical group. And what that group is going to do is just they are going to distribute. Okay, they are going to distribute the amount among the physicians. So who are being involved in the care, they are going to distribute their amount. And coming to the network model HMO. So what is this network model HMO? Is nothing but this is also a contract with individuals. What is it? It is a contract with the individuals or a single person if you take, or group hospitals to provide the care. Network. What is this network? Okay. It is forming a network where it is having a contract with more than one physician group or a single or a group of hospital. This HMO just forms like a network.
Yeah, Samina, mute.
So here what they do is like they network. You know what is network, okay? From forming a group. So here mainly what does they do is they have a contract with more, it may be one physician or more physicians. It may be 2 or 3 or 4, or a single physician and a group of hospitals, and they form a network. And here these members, what happens is the members, they can select a primary care physician. Okay, here the members who are coming into this group, the policy holders can select one primary physician, a caregiver they can select in a network, and they can get the health benefits from that medical model HMO. And coming to the individual practice association model, if you see, this is the individual practice association model. So even if you see, this is a type of health maintenance organization. Mainly what happens here is the individual physicians see patients who are enrolled in the HMO. So what will they do? This IPA is individual practice association model. So what they do is they will have a separately owned the practices. The name itself, individual means solo. Okay, and they have a contract with physicians separately or through an IPA. So mainly what happens in this is they will just provide the care who are enrolled in the health management organization, health maintenance organization. Okay, the patient should get enrolled, but HMO, and they also but also the treatment they own for their patients. Okay, they own for the patients who are not HMO participants. But what will they do here in this individual practices? One thing, they will check the patients. Okay, they will provide the care for the patients, or the physicians will see the patients who are enrolled in the HMO. That means who are claiming this HMO. And also they provide treatment to their own patients, who are not HMO participants. For the two people, they are providing the care. For the enrolled people, they are providing the care, and also to the participants, to their own patients who are not coming under the HMO participants. Okay, and next you have another model called like group model. Okay, you have another model called a group model. Okay, so this group model is like, if you take, sorry, it is not group model, it is a fixed, I'm extremely sorry, mixed model. Okay, you have a mixed model where it is nothing but it is a combination of 2 or more. Okay, if you're taking the above models that we have seen, like individual practice association model, network model, okay, this all comes under the mixed model. If a patient is taking a combination of 1 or 2 models together for their health benefits. Okay, and next, if you see, you have like so what is the difference? Now, like we have seen about this managed care till now. So what is the difference? I said there is a slight difference with your health insurance and with the managed care. So what is the difference if you say this health insurance, like we can also call it as like a traditional healthcare insurance. So what is the difference between managed care and the health insurance? So there is a difference. Traditional health insurances is what they will allow you to select your healthcare providers, right? And next, what they do is like providers, and you can select like your favorite doctor, or you can claim your favorite hospital, like the hospital you are comfortable with to have a care, and you can also select your doctor. And also you may and like you may have to pay for services when rendered, and then submit your bill to the insurance company for the claiming. That is the traditional healthcare insurances that is going to happen in general. And next, coming to this managed care. So what is this managed care? Is nothing but this will combine the delivery. Okay, this will combine the delivery, and it will finance, it will provide helping in the finance of the healthcare services. But it is having one, we can say a disadvantage or a restriction, but it may restrict your choice of doctors. Here in the traditional health insurance or a general health insurance, what was happening? You can select your favorite doctor, or you can select your favorite hospital, like whom you are comfortable to go and have a treatment in the general health insurance. But here in the managed healthcare, you will have restriction of the choices of the doctor and the hospitals, like only in a network, whatever the network hospitals are there, whatever this management organization that is there, only you can select accordingly through that. But here what happens is, in turn, you have one benefit, that is you will pay less for your medical aids. Yes, for your treatment, you will just pay very less for your medical aids if you compare with your traditional health insurance and your managed care insurance. Managed care insurance are very less. That means you pay very less for your medical aids. And also this managed care, what happens is, it will access your healthcare facilities. Okay, it will give you a discount rate. Okay, this managed care plans, what will do is, it will give you a discount rates. And these plans, if you see, they provide complete coverage. They will complete, you have certain pros and cons in this condition. Okay, mainly what happens here is, the plans that they provide is completely coverage for a set price. Okay, and it includes regular health checkup. And as I already said you, this will focus on the preventive treatment. Okay, this mainly focuses on the preventive treatment. And the plans that you have till now, what you have seen, like individual model, group model, okay, various types of organizations we have seen. So all that models or plans or organization that you have, these all are very least expensive. These are very like very less expensive. As long as the insured patient receives the care at the network hospital, they will have a least expenses, and they also have a less paper work. If you see, they have a very less paperwork compared to your traditional general health insurance. I already said you so in beginning. So this managed care was developed in United States of America. Okay, United States of America. So here, like once I'll just revise what are these models, and we will go into the other topic. First one was your health maintenance organization. Yes, health maintenance organization. So what was this health maintenance organization? So here we just will revise the modules or the models of this insurance comes under this managed care. So first one is HMO. So this is health maintenance organization. Here what happens is, like you have like several difference between this HMO plans, if you see. So mainly what they do is, it will primary first, this plan will have a it will mainly focus on your primary care provider. And this primary care provider physician, what they will do is, they will just refer you to a specialist. If in this concept, in this health maintenance organization, what happens is, if you want to go to a specialist, you want to consult a specialist, just like that, you cannot go and consult a specialist. So here what happens is, first you have to just follow, or you have to go to your primary care physician, then he will do your checkup. Is it necessary to go for a specialist consultation? And if it is necessary, then they will then your primary physician, okay, who is going to take care of your health checkups and all. So he will just refer you to the specialist. And like the policy holder must stay within the network of providers to receive the coverage. So whatever the coverage, whatever the contract that is there between the policy holder and company, so they have to just follow and receive the coverage that is being used within the network. Okay, and mainly this organization, what they do is they provide the health insurance coverage for like a monthly fee, or they can pay for a annual fee. And this also they will have limit. Okay, they will have a limit. And in this contract, if you say this HMO contract, if you say they have certain restrictions, they cannot go to all the doctors, and they don't have a freedom to go to all the doctors. That was about your HMO, Health Maintenance Organization. And coming to a staff model organization. So what is this staff model organization? Is nothing but here the patient can receive services. Here your patient will receive the services. Just a minute. Yeah, he will receive services only through a limited number of providers. The patient, okay, as I said you, this all modules, if you take, you have restrictions. Here also only to a limited number of providers, one or two physicians the patient may go. Okay. And here what happens is, as this HMO, it hires the physicians and they will pay the salary. And this HMOs also comes under their own network from the own clinical sites or from the health centers. Okay, this HMO will pay salary to the physicians, doctors, or to the network people, or to the team of people. And also not only the salary, but also they will be getting certain incentives according to their performances. So they are going to have a bonus or an incentive facility. Okay, and coming to a group model. So what is this? A group model is nothing but this HMO will take a contract. This health maintenance organization will take a contract either with a single multi-speciality medical group. Okay, and also what it will do is it will provide a medical care to the HMO who are coming under the HMO membership. And also what they do is they are like they work exclusively with the HMOs and non-HMO patients as well. That means the patients who are included in HMOs and the patients who are not covered under the coverage of the HMOs also, the medical team, that is the group model, will be dealing with them. So who are not under non-HMOs, the money, the amount is the payment that they get from the patients will be different amount. Okay, the people who just come, the team members who just, the network people who come under the HMO, the amount is different. The charges will be different for the patients if you compare to the non-HMO patients. And this HMO, what they do is, this group model HMO, they will pay to the medical group. Okay, whoever the group is there, they will pay to, for example, if you take the physician is the head of the group model. Okay, so what they do, they just pay to the head of a group, and this group, what they do, what the payment they are receiving is, they will just distribute within them. Okay. And next one, if you see, there is a network model. Okay, network model HMO. So this network, already we have seen that you will be having a contract with individual groups, with the hospitals to provide the care. So they will have a link, they will have a bond with the hospitals, with the diagnostic centers, with the patients, with the policy holders, with the doctors, where to provide the care for the patients. Here they will have contract like we discussed. Either it may be one patient or group of patients and with the group of hospitals. And next here, if you see here, next is the individual practice association model. The name itself is telling individual practice association model. So here what happens is, the physician will see the individuals who are enrolled with the HMO, who are enrolled with the HMO. For example, if I am enrolled in the HMO concept, in the HMO network, the physician, individual physician is going to take care of me. Not only me, but the outside patients also who are not participants of the HMO. But the charges they are claiming for me and the charges they are claiming for the outside patient, that is who doesn't come under the HMO participant, will be different. So the individual practice takes place in this individual practice model. And next one is mixed model. You all know what is this mixed model. If a patient is like taking combination of 2, 3 models, now all the networks we have seen, if the patient is taking staff model, if the patient is taking a coverage of group model, then they come under this mixed model, combination of 2 or more. And next one is preferred provider organization. So what is this preferred provider organization? So this preferred, yeah. So you have few preferred provider organization. So this preferred provider organization, what is it? It is a type of medical plan again. Okay. And it covers the participants who are provided to the participants who are coming under the network, who are selected for the healthcare providers. Like example, if you take hospitals and physicians, they are the preferred provider organization. So you pay less if you use providers, okay, which they belong. You have a network. You have to go to the network doctors only. You have to go to the network hospitals only. You have to go to the healthcare providers, to the network providers only for their for the coverage. If you go outside, if you go out of the network, if you go out of the coverage, then you have to pay additional charges. That is preferred provider organization. You will prefer few network people, that is like who comes under hospital doctors, etc. That is preferred provider organization. And next, coming to a point of service plan. So you have point of service plan. This is also a type of managed care health insurance plan. What is this doing is it is providing different benefits for you. Okay, it is providing different benefits, whereas if you see, it depends upon the policy holder network, which network the patient is choosing, or whether the patient is outside the network, either inside the network or outside the network. And what mainly happens in this is they will plan offer like very low cost. Okay, the plans will be very low cost, but the providers are very limited. Two things you can observe here. What happens is they will offer for the low cost, but the doctors, the hospital, the healthcare providers are very limited in this point of service plan. And they can, if they are not convinced with the providers, if they are not convinced with the network, what they can do is they can go out of the network. They can go out of the network. Again, one thing you have to remember, once they are going out of the network, they have to pay the additional charges, whoever it is. If it is a preferred provider organization, priorly if you are selecting a coverage where you select only the healthcare providers like hospitals and physicians in preferred provider organization, and if you're coming to the point of service plan, also here, what you have a very less amount you will pay for your treatment, but only limited. You cannot go to doctor A, B, C, D, E, and F. You can go to A, B, C, and D. That's it. If you want to go to E, D, F, and G, other doctors, then you have to pay an additional charges for that thing. And next, if you see physician hospital organization. So what is this physician hospital organization is? Mainly what does this hospitals do is, the hospitals and the physicians are the agents. Physician hospital organization. The name itself is telling. Physician means what? Doctors. Yes, the doctors hospital organization. So who are representing the hospital? The hospitals and the physicians are acting like a agents of the organization. So they are herely, if you see, here if you see, you will have a legal hospitals, and the physicians are also comes under legal, like they allow them to come together. If you see the hospitals and the doctors, they come together, and this is called as a medical staff organization. What it is? Medical staff organization, because the hospital team, hospital network, and the physician network is coming together and forming a medical staff organization. So this organization is also called as a medical staff organization. And next, coming to the management service organization. So you have a management service organization. So what is this management service organization? Is nothing but the name itself is telling management service organization. So what here? This will provide non-clinical services. Till now, all the models are involved. Hence, like taking the services coming under certain plans, okay, coming under certain network. If they are out of the network, they will be charged for the extra charges, etc., extra claims and all. So here, management service organization, they will be taking care of non-clinical services, like if you take billing, accounts, collection, how much accounts have been paid by the policy holders. All these details are done with the management service organization. And here, if you see, you have like three types of main managed care plans, as we have discussed. I will not go in detail, but health maintenance organization. Here, one simple points I will tell, and I will close with this point. So first is health maintenance organization. What it will do is it will usually only pay for care. It will pay for the service within the network. That is health maintenance organization. Preferred provider organization means what? Usually they will pay more. Usually they will pay more if you get care with the network. Okay, if you get care with the network. And coming to your point of service, what happens is your plan will give you a choice. Your plan will give you a choice between whether you want to go with HMO or whether you want to go to PPO, that is preferred provider organization, whether you want to have a limited services, limited network, or you want to go beyond. If you go beyond, one thing you have to remember that you have to pay for it. That is the thing. Understood? And next, if you see this HMO coverage, yeah, in this, if you see in this HMO in detail, you have in your textbooks. So here they gave this IPO. So yeah, we will discuss about this and we will just a minute. Give me some. So in this organizations, three are important. What are important? In the previous slide, we were having three are important. These three are very important in the managed care plans. First one was HMO. Mainly it covers your medical care plan. It will highlight on the sickness, mainly the prevention. HMO focuses on the prevention. Always the sickness should be an avoidance. Okay, it will highlight on the sickness avoidance. With this medical coverage, what happens it is a border range for the preventive healthcare services where you can get rendered. Okay. And next, if you see this, whereas in this coverage, you can pick up certain specialists from your network organization. But if you're, for example, now you are going to this HMO, and what happens after you go to the HMO, daily you are preventive, like a preventive services for the follow-up checkup. If you take a patient having like what do you say, like if a patient is having some cardiac hypertension, what do the patient do? The patient have to go for the follow-up checkup, right? The patient have to go for the follow-up checkup. The doctor have to check his blood pressure, and he have to rectify, or he should evaluate whether your patient is having any complication. How is the blood pressure? Whether the blood pressure is increasing or decreasing for the patient, whether the medications are working for the patient or not. So this patient, like a preventive measure, so that in order in future he should not be affected with the illness, with the critical illness, this patient will be going on to a doctor. And what he will do, he will be going on to a doctor, a general, like a specialist. He will be going on within the network, I'm telling. He will be going and he will be having the investigation or a entire clinical requirements. Okay. Suddenly what happens? The patient is suffering with some weakening of the, if you take a cerebral pain, headache, severe headache, your patient is having, and he was having some neurological signs and symptoms like vomiting, nausea, convulsions, fits, etc. Now, what this general physician will do? He have to refer to a specialist. He should refer to a specialist. So this person, now what he will do is, this doctor, a general doctor, he will investigate, he will check the patient, and he will come to know, Array, I am not sufficient. Okay, he should like require some specialty treatment. So this doctor, what he will do is he will refer the patient to the specialist. He will refer the patient to the specialist, and there the patient can get a treatment. Okay, then the patient can get a treatment with the specialist. So here one thing you have to remember, one thing is what? The patient know that I am having some neurological complication. Why I should go to the general doctor directly? I will go to the specialist. No. In this HMO, patient cannot go like that. The patient have to go to the first primary health taker or a primary provider or first specialist or the first doctor. Then he will do the investigation of the patient. And if he thinks, yes, this patient needs to have a specialty checkup, he should have a consultation with the neurology specialist. Then he will refer the patient to the specialist. Then this patient will go to the another specialist. So this is about your HMO. And coming to the preferred provider organization, here what happens is in PPO, not required to stay in the network. The patient can be in the network or cannot be in the network. Here in HMO, referral is important. Your primary doctor, for example, if I am a primary doctor, I should refer. I should write in the paper. I should give a document stating that I am referring a patient to the another doctor, or I am referring a patient to the another specialty hospital. That is required in HMO. If you come to PPO, reference is not needed. If I am a patient, I don't need any reference like HMO. In HMO, reference is important. One doctor should refer me to the another doctor. But in PPO, what happens is, in this scheme, you will not need any reference. No reference is necessary for the patient. And mainly what happens is, this will offer more flexibility in choosing the healthcare physician. In HMO, limited doctors. Like I said, you A, B, C, and D. You cannot go to E, F, G, and H. Okay. Coming to this, here what happens is, you can see, or for example, I will tell, I can choose a preferred provider organization because I have a freedom to see any doctor. I have a freedom to see any doctor I want in PPO. It is like more flexible comparing to HMO. Okay, it is more flexible comparing to HMO. Okay, and next we will see this exclusive provider organization. Okay, in spite already we have seen this point of service, but again in your textbook you have your exclusive provider organization. So what is this exclusive provider organization? This is a combination of, again, same like point of service. This is also related with your point of service. Like previously how we have discussed, it is combined with HMO and PPO. This will require a referral to see a specialist. If you select POS, point of service, or exclusive provider organization, here you should have a referral again. And but if you see this POS is a very good option for the people who want to save their money, yes, on their premiums. Okay, and they don't mind having smaller networks. Okay, for some people they might know, array, this network is small, I want to go to another scheme because it is giving a good coverage. But in this, if you see the people who want to save their money, the people who just, they are not bothered with their smaller network, with their premiums, they can select this point of service because this is having a limited coverage. And if you see this POS, it does not allow you to see doctors or specialists outside the network. In case of emergency only, you can go out of the network. Okay. In POS, one thing you have to remember again, this is having a very small network. If your patient is compromised, yes, I can manage my coverage with small network, then happily your patient can take this POS. Lower premiums are compared with, if you see, PPOs and PPO. PPO is very higher. If you take PPO is very higher because you have unlimited there. You don't have like a restriction. You do not have referral. So obviously the PPO premiums are higher. And if you take this POS, the premiums are lower. Okay, so this is about your thing. And next here, you have certain components. Okay, components we have already seen, I think. So we will discuss about this provider network. What is this provider network? Okay, utilization, provider network. Okay, you have, okay, some managed points. So first we will see what is this provider network. What is this provider network now? The health insurance company that is having a contract with a group of providers, okay, which is offering a plan to a members. That is the provider network. That means what network you are providing to your group of people. That is nothing but your health insurance companies. It will have a contract with the group of providers. Like if you take, it will have a contract with the doctors. It will have contract with what? With the hospitals. It will have contract with the healthcare providers. So this is about your health insurance company that is having a contract. Why? To provide some care for your patients. It will form a network and it will provide care for the patients. And it is also like a group of healthcare providers that have engaged with an insurance company. Yes, some people, yes, group of this policy holders are engaged with insurance companies. Why? To provide medical services to their policy holders. Obviously, why we are giving this medical services or medical insurances to the people, in order so that they will benefit it, they will get benefit with the medical services. Whereas here you have list of doctors, other health providers, and hospitals, diagnostic diagnostic centers. This all comes under the network to provide the care for the members. Okay. And you have certain benefits of this provider network. Provider network is nothing but the people who are bonding together, the people who are contracting together to provide the care. Now here, who are providing the care? Doctors are providing, yes. And who else? Your hospitals are providing, the health team members are providing the care for the policy holders. That is, and they are forming like a network. They are forming like a network. Thus, it is termed as provider network. Understood? And we have certain benefits for this provider network. Mainly, what they do is they provide coverage benefit. Okay, they provide coverage benefit at a lower cost. One benefit is what? They are giving benefit for us in a very lower cost. And also, if you see So I'm extremely sorry for the delay. So we were talking about the benefits of this provider network, right? So here mainly what will happen is the network members within the team are called as in-network providers. Okay, the payers, the policy holders who come under the network are called as in-network. These providers that are included in the payers network are considered as in-network. The people who come under, like the providers who are contracted with the plan, okay, they just have a contract. Sometimes they will not be in contract, so they are called as out of network provider. Out of network provider. Okay, so this is in network and out network. If they are considered within the network provider, then we will obviously call it as they are in of our network, we call them as an in network. So when this insurers, okay, often have different provider networks from the different health plans. Okay, sometimes they select this out of network providers also. And next, if you see this in the PPOs, you pay very less without a referral and you use doctors, hospital and providers out of the network. Okay, and here if you see in this utilization, okay, here in this topic again, like you have patient access system. This already we have been discussed. Yes, in this patient access system. So what is this access? You know, you all know what is this patient access. That is nothing but the availability of healthcare that you are providing and ability where your consumers access your care and the treatment. That is patient access. The benefit, the availability that you are providing to your policy holders. That is ability where your consumers or your customers will access your care and they receive your treatment. Okay, and mostly this also refers to various process and procedures. If you see, mainly what happens in this, the help, the where this procedures, this process will help the patient access to improve the healthcare system. So why this patient access is important? Yes, it is important. Why it is important? Because it will improve our healthcare system. It will help our healthcare system. And this services also include, now this patient access system, if you see, this will include your scheduling, appointment, registration for the services. Okay. And if you see this, obtaining the insurance coverage and more, all this should be documented or this should be accessed by the patient. If this availability of this health services are there only, even they also nicely come and access your what benefits that you are availing for the patients. Okay, there are certain benefits of this patient access system. So what are the benefits? First one, if you see, it will increase the revenue flow. Yes, obviously it will increase your revenue flow by beginning with the identification of customers and market sales in the market. Okay, the sales and all this will all attract the policy holders. Thus, it will increase the revenue system. This identification of customers, marketing is very, very important. If you do this well enough, then obviously it will attract your policy holders and this will increase your revenue flow. And next coming, you have increased accuracy in the healthcare. So what is this increased accuracy? What is accuracy? Here, especially you have to ensure that the accuracy is very, very important in the healthcare system because responsible. Okay, it is important and responsible with the patient care. As you wish, you cannot document. As you wish, you cannot avail the healthcare service to the patient. It should be responsible. Your patient care is responsible, whereas the data that you are taking, okay, the inaccurate data, what will happen if you are taking a wrong information about a patient, if you're not collecting an accurate information about the patient? What will happen with this? It will lead to any severe complications we cannot imagine, because this is about your healthcare system. Anything may happen if you're just documenting a wrong information of, or if you are like availing a wrong access system to your patient. So it should be accurate. The system should be accurate. So if you are maintaining this patient access system, the accurate information, and you will be responsible towards your patient care. And the other benefit, if you see, we can evaluate the patient satisfaction, right? Yes, if the patient is like, if your patient is having a good access, availability of the services, okay, and the care that you are giving to the patient, the treatment that you are giving to the patient, obviously what will happen if you are giving all this in a well mannered, the patient satisfaction will increase. Yes, your patient will feel happy for your service. Sometimes it happens, no, when a patient is consulting a doctor, patient is coming to a hospital consulting a doctor, and like seeing the patient has been waiting for a doctor consultation to enter into a consultation room. The patient has been waiting for half an hour, 1 hour, 2 hours, 3 hours, from morning till half an hour. The patient is going on waiting for a doctor. What happens here? Will the patient feel happy? No, the patient will not feel happy. What is this hospital? What is this care that they are providing for the patient? The patient has to wait for 3-4 hours till afternoon. We are being waiting. Next time, the patient will not step into your hospital because of the access that you are providing for your patients. So, patient satisfaction is very, very important. Always, we have to see with this patient access system, we have to see that you are providing, or you are elevating the satisfaction of your patients. You should see how happy your patient is. You have to measure that happiness when your patient is being visited, and you have to measure with your patient access system. And coming, increase accountability. If you maintain this patient access system availability, you should, it will help us to be responsible for like, if you see, for what you are doing, what you are able to do, okay, it will give you a satisfactory reason, especially willingness to accept the responsibility. It is nothing but, what is this increasing accountability is nothing but you are willing to accept the responsibility. Accountability is very, very important. Obviously, we all have, or we will show in our work centers, right? Accountability. If you are not accountable for what you are doing, can you work in that area? No, you cannot work in such area. And coming to the utilization management in insurance. So what is this utilization management in insurance? It is nothing but, here if you see, set of techniques are used on behalf of the purchaser of the healthcare benefits to manage the healthcare cost. Here what you do is, you will influence the patient care decision for utilizing the insurance management. Okay, here what we do is, you have certain techniques, you have certain regulations, where what you do is, you will influence your patient care decisions in the healthcare cost. Here you can manage the healthcare talks by influencing your patient care management. And with this, what happens is, it is also like it will evaluate the appropriateness and medical necessity. What is important, what is not important. Okay, what procedure is important for the patient, what medical necessity is important for the patient, what treatment is important, whether this test is important or not for the patient, whether this test is needed or not for the patient. That all we will see in this utilization management. What all are utilized for the patient. Okay, whether whatever we are utilizing for the patient is benefited for the patient or not. So this patients are on like case by case process. Case by case process, we have to see the facilities of the patient. Okay, what treatment we have given for the patient, what services we have given for the patient, what procedures we have done for the patients, whether the all you have done for the patient necessity are utilized or not for the patients, that you will be checking. And here if you see, this will involve, this utilization management will involve both the inpatient and outpatient services. Okay, inpatient and outpatient services. Whether the insurance company, okay, mainly whether to see, make sure that all the benefits provided by the company are used properly or not. Whether the company is using the benefits properly. Utilization rate. How is the utilization rate of the management or the insurance, that you will check. Here mainly what happens, it involves a cost decrease and unnecessary procedures. What is the benefit of this? One benefit or overall benefit of this utilization management is mainly it will see the cost is decreased for the patient, and it will also check that unnecessary procedures, whatever the unnecessary procedures are there, is not done for the patients. Okay, this is about your utilization management. Okay, and here you have a quality management. Okay, you have a quality management. So what is this quality management? Quality in whatever the care that you are providing, whatever the service that you are providing, whatever the organization that is taking that initiation, the market, the company, or whatever it is, it should maintain a quality. Yes, the main objective of this quality management is that it should ensure that a particular product, the service, the organization is consistently fulfilling the intended purpose for what you are delivering the product, for what you are delivering the service for the patients or for the policy holders. It should maintain a quality. Quality is very, very important nowadays if you see. So increase quality is important, and the data, especially the data that you monitor, the record, the data collection, etc. Everything is important. Okay, data, mainly in data, what you will do? You have to record some data of the patient. You have to collect some data collection. What is the biographical data? What is the diagnostic finding of a patient? What is the investigations that are going on for your patient? What is the medical management that is going on for your patient? This all comes under your data, not only related to your patient information or a disease condition, but also it is related to the insurance claiming, accounts, etc. and all. And coming to the, if you see patient engagement also, like patient engagement also is very, very important. What is that one? Communication and education is important for the patient. So what is this communication and education? Communication is important with your patient. Yes, communication. Always you have to communicate with your patient, as well as you have to educate your patient related to your claim, your organization. So whatever it is, that is very, very important. With communication, with your education also, you can increase your quality system. Quality system. For example, I'll tell you one example. Like, I don't know how much time, only 1 minute we have. Okay, because, okay. Next one is customer service. Okay, you have a customer service. What is customer service? Is nothing but in healthcare, it is more important that the time of the patient spends interacting with the